LASIK is a popular laser vision correction surgery that provides glasses-free vision. However, traditional LASIK procedure that involve flap creation comes with certain risk and complication. In today's video, we'll discuss in detail flap-related complications which can occur in flap-based LASIK surgeries like LASIK, Contoura Vision, femtosecond and Innoveyes. The most common LASIK complications are flap-related. Whether the flap is created using a traditional microkeratome blade or a femtosecond laser. The method of flap creation determines this type of risk involved. A microkeratome uses an oscillating blade to cut the corneal flap. It is a traditional technique and is relatively faster, but it has higher risk because it is a manual cutting process. Suction loss or blade defects can increase the chances of complications. On the other hand, femtosecond laser is more advanced technique that uses high precision laser pulses to create the corneal flap. It is a bladeless technique offering more accuracy and predictable results. However, flap-related complication can occur regardless of whether the flap is created with a blade or a femtosecond laser. Let's understand these complications in detail. Flap dislocation or flap moving or shifting after surgery. In flap-based LASIK, a thin corneal flap is created which is repositioned after the laser treatment. However, if the patient accidentally rubs or touches their eye after surgery, the flap may shift from its place, leading to blurry vision. This complication is more common in the first few days after surgery when the flap has not settled properly. Flap wrinkles or flap striae, meaning irregular healing causing vision loss. If the flap does not settle properly or heals in a wrinkled form, the patient may experience double vision or distorted vision. Wrinkles in the flap can affect high-definition vision, reducing the clarity. In severe cases, flap repositioning surgery or touch-up laser treatment may be required. Diffuse lamellar keratitis or inflammation under the flap. DLK is an inflammatory condition that develops under the LASIK flap. The main cause of DLK include dust particles or the bacterial contamination which gets trapped under the flap after the surgery. If left untreated, DLK can lead to permanent corneal scarring and vision loss. Corneal ectasia or weakening of the cornea after LASIK. Corneal ectasia is a serious complication that occurs when too much corneal tissue is removed, making the cornea weak. Flap-based surgeries render your cornea slightly weak because of the creation of the flap. This can result in permanent vision distortion or progressive myopia. In extreme cases, patient may require corneal transplant. Intraoperative bleeding or bleeding inside the eye during surgery. This complication occurs when the corneal tissue or blood vessels are damaged during the surgery, leading to bleeding inside the eye during and after surgery. If a patient already has dry eyes or thin corneas, the epithelium, the outer layer of the cornea, may get damaged during the flap creation, causing bleeding. This complication is more common in older patients or those who have worn contact lenses for many years. Limbal bleeding. Limbal hemorrhages can occur due to the use of microkeratome blade or femtosecond laser. Limbal bleeding happens in area between the cornea and conjunctiva. The main causes include large diameter flaps, hyperopia or farsightedness, and improperly sized or wrongly positioned suction rings. People who have used contact lenses for longer period are at higher risk of limbal bleeding. Limbal bleeding can slow your recovery, leading to complications. Epithelium ingrowth or cell growth under the flap. Sometimes the epithelial cells start growing under the flap, creating a layer between the flap and the cornea. This condition can distort vision and in severe cases, flap repositioning surgery may be required. This complication is more common in patients who already have dry eyes or corneal irregularities. Flap buttonholing or incorrect flap cuts or irregular shape. During the flap creation, if the blade or laser does not work properly, the flap may develop gaps or holes. This complication is mostly seen in microkeratome-based traditional LASIK, where the flap may have uneven thickness. If a buttonhole develops, permanent vision loss can occur, requiring corrective surgeries. Dry eyes and flap edge issues leading to reduced tear production due to nerve damage. During flap creation, corneal nerves are cut, affecting tear production. As a result, patient may experience dry eyes, irritation and discomfort. In some cases, flap edges do not heal properly, leading to chronic dry eye syndrome. Traditional LASIK comes with flap-related complication which can lead to long-term vision problems. That's why flapless procedures like SmartSurf or Customized are the best option. Customized and SmartSurf are flapless, bladeless and touch-free procedure, eliminating all risk associated with flap-based LASIK. No flap creation means zero risk of flap dislocation and wrinkles. No epithelial ingrowth means no cell growth issues under the flap. Safer for sportsmen and defense personnel as their physical activity is high and risk of flap injury is minimized. Safer for people with thin corneas as flap surgeries are not recommended in such cases. So what are you waiting for? Pick up your phone and call our helpline number today and book your free consultation.